Hi, I'm Ed Miller. I was the Dean and CEO of Johns Hopkins Medicine from January of 1997 through June 30th of 2012. I'm very pleased to participate in the TEDMED conference related to Bristol, England. Now, Bristol has a special place in my heart because in the 1970s and 80s when I was at the University of Virginia, many people from the anesthesia department in Bristol came to UVA, and I worked with them. Also had many visits to Bristol. Academic healthcare centers are going under great transformation. One of the reasons is that we are trying to deliver better care at lower cost. But because of the governance model, this has not always been possible. I thought I'd give you some examples of why Johns Hopkins Medicine was formed and some of the accomplishments that we've been able to make because of Johns Hopkins Medicine. A little bit of history is important. Johns Hopkins, it is Johns Hopkins, died on Christmas Eve of 1873. He left $7 million, half to start a university and half to start a hospital. The university opened in 1876, the hospital opened in 1889, and the School of Medicine in 1893, the School of Medicine being a part of the university. The two institutions, that is the hospital and eventually the health system, and the university were two separate organizations. They had their own board of trustees. And over the intervening years, a friction between the hospital and health system and the School of Medicine emerged. In the 90s, that problems between the two became quite severe, to the point that the board of trustees from both the university and the hospital and health system decided a new model was in order. A committee of 10 was formed, included people like Mike Bloomberg, the current mayor of New York, Shale Stiller, and a variety of other notables within the Baltimore region. They decided that Johns Hopkins Medicine should be formed and that the boards of the Johns Hopkins University and the board of the hospital and health system would delegate to a new board called Johns Hopkins Medicine. In January of 1997, I was appointed the first dean, CEO, and held that position until June of 2012. Well, what are some of the accomplishments that we were able to make in those 15 and a half years? First, we were able to get both sides of the street to talk to each other. That seems kind of simple, but that's really what happened. And part of it is we had transparency of the financial data. And so a lot of the mystique about what went on one side or the other was no longer a mystique, but open to all people to look at. But then we tackled some big problems, and they were big problems. Because of the division between the hospital and the health system and the School of Medicine, no new building structure, no buildings had been constructed. So we started on a plan about how could we revitalize the East Baltimore campus. And in those 15 years, because we developed a 10-year financial plan, we were able to build $2 billion of new buildings, namely a new hospital, a new educational building, and several research buildings. So that was one very important step that made us move forward. The second was we had in 2001 a real tragedy. We had two notable deaths, one of a human volunteer in a study. The second, an 18-month-old child had come to our hospital with burns. What we found was that when we looked at our own procedures, we had not done it right. And we decided that it was important for us to be the safest hospital in the world. And we started on a journey, it's never been complete, but it will be, to make sure that every patient that came into our hospital or in any of our facilities would be well cared for and be the safest in the world. We started an Institute of Patient Safety. It's now called the Armstrong Institute of Patient Safety, led by Peter Pronovost. The next thing that we tackled was the international scene. Many people came to Hopkins, but we also were getting requests for people to come to us from out the world about how could they run their health systems better. And we expanded Johns Hopkins internationally significantly under the leadership of Steve Thompson. And then last, And I think most importantly, we believe that the fee-for-service system will not be able to survive in this country. It was just not be able to be financially stable moving forward. And therefore, we thought population health would be the way we needed to go. Take care of a population of people for a fixed amount of money and give very high quality care in doing that. Therefore, we decided and embarked upon a plan to build our primary care network, and not only in the Baltimore region, but the Baltimore-Washington region. We acquired 3 hospitals, Howard County, Sibley, and Suburban Hospital, and we therefore are now able to deliver health care not only to a small group of people within the Baltimore region, but a very wide group of people in the Baltimore-Washington region. So as I look back on my 15 years of leadership at Hopkins, I think the model that was set up by the trustees has been very worthwhile. We have made significant progress in how we deliver our care. At the same time, we have kept in focus the educational and research priorities of the institution. So I appreciate the ability to speak briefly to you on this very important subject. Thank you.